So not only do I need to use math for figuring out medications, but I also need to use math for weight. If someone is coming in for a weight loss program, or if they are having issues with their thyroid, a lot of times we have to look up a previous weight or a previous number. And then when we get the current results, we have to figure out how much the numbers are different. So Brooke, I'm gonna call her medication to the pharmacy, and she's gonna have to call the pharmacy to pick up her medication. However, I do have other patients here who need medications that I do give here. Sometimes I measure in a measuring cup, which has a lot of numbers on the side. I need to use math for that as well. Figuring out how much that person needs based on their weight, and then filling the cup to the appropriate level. I also have shots that I give here, and so I will need to measure out the appropriate amount for that person based on their weight. Each device that I use has certain little tick marks and also numbers on them. So after doing my calculations on their weight and how much medication is needed, I'm going to have to fill this syringe to tick mark number 2. I fill it up with air first, poke the needle in, turn it upside down, push the air in, and then I can pull it back out to the tick mark number 2. This is a negative pressure bottle, so if I don't put the air in, it's going to be very, very difficult, and I may not even be able to pull the medication out. I need to make sure all of the air bubbles are out of the medication, and I do that with a few little flicks. Push the air back up, and then pull it back down to make sure I get to the 2 mark. Now I'm ready to go see the patient. So the medication Brooke needs is called Lamodal. And Lamodal, we give 400 milligrams for every 100 pounds. Brooke weighed today at 50 pounds. How much Lamodal is she going to need?